Hey everyone, and welcome. So picture this. It's 2 in the morning, your child is sick, and you're standing in the kitchen, squinting at a medicine bottle, trying to figure out the right dose. If that sounds familiar, this is for you. We're going to cut through all that confusion and talk about the most common and most critical mistakes parents make with kids' medicine. By the end of this, you'll have a super clear, modern checklist to keep your little ones safe. Let's dive in.
The single biggest mistake we see is something I like to call the age trap. It's this really outdated idea that your child's age is the best way to figure out their medicine dose. But, as you're about to see, that's just not how modern medicine works anymore. Today, it is all about one thing: their weight.
The reality is medical guidelines have totally moved on. Dosing a child based on their birthday is an old system that just isn't considered best practice anymore. So, why the big change? Well, it's pretty simple. Kids of the same age can have wildly different weights. I mean, think about it. You could have one 3-year-old who weighs 10 kilograms and another who weighs 15. That's a 50% difference in body mass, and when it comes to medicine, that's a total game changer.
So this brings us to the most important principle, the new golden rule for keeping your child safe. When we're talking about medicine, weight is everything. Not their age, not how tall they are, just their current weight, in kilograms. That is the only way you can be sure you're giving them a precise and safe dose. And you can see the risks laid out pretty clearly here. These age-based bands, like for ages 2 to 4, they completely ignore whether a child is underweight or overweight. And this can lead to some really massive dosing errors. Weight-based dosing, on the other hand, is tailored specifically to your child's body. It's the gold standard, and really it's the only appropriate method to keep them safe.
And just how big can those errors be? Well, if you follow the age on the box, you could be off by 20 to 50%. That is huge. If you underdose, the medicine probably won't work and your child stays sick. But if you overdose, you're risking serious, potentially harmful side effects. It's all about precision.
I love this analogy. It makes it so simple. You wouldn't walk into a shoe store and say, "My kid is 4, so just give me the 4-year-old size shoe," right? Of course not. You measure their foot to get a perfect fit because every single kid grows differently. Medicine is exactly the same. You have to measure their weight to get the dose just right. Okay, so let's take that golden rule and apply it to our next scenario, dealing with fever and pain. This is one of the most common reasons we reach into the medicine cabinet, so let's make sure what's in there is both safe and effective. So, with all the options on the pharmacy shelf, what should you actually be using for your child's fever and pain? It can feel pretty confusing, but the good news is the expert recommendations are actually very simple and really just focus on a couple of core, safe options.
Here are your 2 main safe choices. First up, you've got paracetamol. This is usually considered the safest go-to option. The standard dose is calculated at 10 to 15 milligrams per kilogram of your child's body weight. Your other option is ibuprofen, which is dosed at 10 milligrams per kilogram. But, and this is a really big but, the warning here is crucial. If you have any reason to suspect dengue fever or any viral illness that comes with bleeding risks, you have to avoid ibuprofen and stick only with paracetamol.
Now let's talk about the things that should never be in your medicine cabinet for your kids. First on the list is Nimesulide. This is a hard no. It's actually banned in many places for kids under 12 because it has a high risk of causing severe liver damage, which is a condition called hepatotoxicity. So just stay away from it.
Second on our never list, at least for routine home care, are injectable painkillers. Doctors have really moved away from these for common childhood sicknesses. And why is that? Well, because getting a shot is painful. It can be really traumatic for a little kid. And honestly, in most cases, it's just not necessary when we have great oral syrups that work perfectly well. Injections are really just for hospital emergencies.
All right, on to our third and final topic, the dreaded stomach bug. When your child has diarrhea, every parental instinct screams, "Make it stop!" But the correct modern approach is actually about managing the situation, not just stopping it cold. So let's look at the smart 3-step plan: hydrate, repair, and restore. This is what we call the TRIO strategy, and it's all based on evidence. Step 1, oral rehydration salts, or ORS. This stuff is the absolute MVP for preventing dehydration. Step 2 is zinc. Now, zinc is a treatment, not just a vitamin. It actually helps repair the gut lining and can even prevent it from happening again. And step 3 is probiotics, which help bring back all the good bacteria. It's also good to remember that most tummy bugs are viral, so antibiotics usually aren't needed unless a doctor specifically recommends them for something like bloody diarrhea.
And now for what is probably the most important warning in this entire section. Never, ever give a child a drug like Loperamide to stop diarrhea. It's sometimes called one of the most abused drugs in pediatrics because it doesn't solve the problem, it actually creates a much bigger and much more dangerous one.
So here's why it's so incredibly dangerous. Loperamide works by basically slowing down or paralyzing the gut. And when the gut is paralyzed, the body can't push out the bacteria or virus that's causing the infection in the first place. This can lead to a really serious condition called paralytic ileus, where the infection gets trapped inside and can get much, much worse, leading to very serious complications.
Wow, we have covered a lot of really crucial information, so let's bring it all together into a simple, actionable checklist that you can use to feel confident and prepared. These are the absolute key takeaways from everything we've talked about today.
Okay, so let's lock this in. 1. Ditch the age, always dose by weight. 2. For pain and fever, paracetamol is your safest first choice. And remember that never list, no Nimesulide and no routine injections. And 3. For tummy troubles, you're going to focus on hydration with ORS and repair with zinc. And absolutely never use Loperamide.
And remember, all this information is meant to empower you, but it is never a substitute for professional medical advice. Always talk to your pediatrician and double-check any dose calculations with them. And I'll leave you with this final thought. Now that you know that weight is the key, the next time your doctor writes a prescription, you know the single most important question to ask. What is the exact dose for my child's current weight? Stay safe, and thanks for joining us.